Bacteroides, fragilis, these are negative growths, usually cocobacilli. They are sized between cocci and bacilli. And these are present also in the intestine. And the other, we will leave them for other lectures. So you have to remember the ones that I have mentioned. Now, as I said, Clostridium perfringens is spore-forming, subterminal. They have alpha toxin, theta toxin, and enterotoxin. They are present in the intestine and in the environment. Sometimes contaminate food. And we said that in the GI, it can cause food poisoning. Can cause cellulitis, gas gangrene, and enterocolitis. The other Clostridia, we will leave them for the moment, and then in another system, we will talk about them in the CNS, inshallah. Gram-negative bacilli, Bacteroides fragilis. These are capsulated microorganisms. You have to remember that Bacteroides fragilis are capsulated. They are present in the intestine. These are opportunistic organisms انتهازية. بالعادة ما تعمل شيء. and can cause abdominal abscess. يعني لو واحد جاء انجري بالبطن نتوقع هذه الميكرو اورجانيزم ان تعمل انفكشن. Clinical capsule, and you remember I always say that the clinical capsule is very important to understand. It gives you the clinical spectrum that this microorganism can cause. So Clostridium perfringens can produce wide range of infection, wound infection, soft tissue infections, and these microorganisms can cause by other opportunistic bacteria that I have mentioned, can cause infection of the body. They require dead tissue in order to grow, and they can cause these microorganisms gas gangrene, as I said. And it starts with injury, small injury probably, and then proliferate and produce gases, hydrogen and CO2, and this is called gas gangrene. They are, once they have established as a gas gangrene, it is very dangerous. It is a killer. It can kill the patient within a short time. Food poisoning, we mentioned it previously, characterized by diarrhea without fever or vomiting. And we mentioned that in the GI. Gas gangrene, it occurs, as I said, after a traumatic wound injury and muscle damage. And this can be associated with accident, automobile accident, car accident, etc. And once there are fractures, bullets in the tissues, in hacking الصيادين. Once you have got such injuries, these microorganisms can enter and establish themselves and can cause gas gangrene. The pathogenesis, they require low redox. What is redox? Low oxygen tension. That is to say, anaerobic condition. Now we said these are spore-forming microorganisms. The spores will germinate and produce the alpha toxin, which can cause tissue damage, mainly to the muscle bundles. And then there will be local and systemic effects and shock. Infection, severe infection, fever, tachycardia, etc. Low blood pressure. The theta toxin contribute also to such an effect on the tissue. We said the theta toxins can cause pores, تثقب الخلايا. You can see this is gas gangrene. You can see this picture, this X-ray. You can see the gas bubbles. هاي النقاط السوداء بالتشيوز بين العضلات بين التشيو. اوكي؟ هذا يعني لك ايش؟ يعني gas gangrene. هذا الشخص دراج ادكت يتعاطى المخدرات وصار عنده انفكشن نتيجة unhygienic injections. Clinical case. عندنا كيس سيناريو. باختصار 24-year-old man has car accident, brought to the hospital with a fracture to the left tibia and fibula, went to surgery, immobilized, and given antibiotic cephalotine. The patient was febrile and hematocrit 41%. You know what's hematocrit? Okay, related to hemoglobin. Okay, and cell precipitation by centrifuge. And white BC is above normal 10.9. On the fourth day, remember, the word fourth day, في اليوم الرابع. The patient starts to have temperature, fever, 38.3, tachycardia, and painful leg with impending doom. What is impending doom? الشعور بالموت. Impending doom بمعنى الشعور بالموت. The cast يعني الجبسون هذا الجبس اللي مجبس رجله، لأن رجله مكسورة فتم وضع جبس عليها. The cast اسمها جبس cast. The cast was open and the area was found swollen, reddish brown, with cirrosanguineous, foul smelling discharge. Crepitation. Why crepitation? If you press on the tissues, gas gangrene. Gases underneath the skin, in the tissues. So it's called the crepitation. شو معناته crepitation؟ يعني زي صوت فرقعات صغيرة ناعمة. اوكي؟ خرخشة. The blood pressure was low, 70/20, and gram stain was done, and they found gram negative and gram positive rolls. The hematocrit decreased to 35%. The white BC increased a little bit. Intravenous penicillin G was given in very high dose, 5 million units every 6 hours, and then have taken to the surgery and they have done amputation, يعني قص الرجل above the knee. لأنه gas gangrene أصبح عنده exotoxins in the tissue. It will be killer to the patient if you don't remove these toxins from the body. So amputation was the treatment and given high dose of antibiotics. Also the gram-negative bacilli due to contamination are present were found to be E. coli. So this clinical scenario shows you how dangerous the Clostridium perfringens in causing gas gangrene. And it occurs usually quite rapidly. So it starts, the gas gangrene, the clinical, within 1 to 4 days. That is why I said, remember the 4th day, right? It can cause pain, heaviness, tissue, edema, heaviness. يعني يحس انه رجله ثقيله بعد. Edema, tenderness, you cannot touch it. And then discoloration. It comes to black color and hemorrhagic bully. Late you get the crepitance, the crepitation, when you press it, the crepitance. And systemic manifestation. If you get local infection with this severity, of course it will be reflected on the systemic. You will get fever, tachycardia, low blood pressure, etc. There is another condition. It's called anaerobic cellulitis. And we have to differentiate it from gas gangrene. VS, it means versus, عكس, بالمقارنة مع. Okay? So, it's a clostridial infection of wounds and subcutaneous tissue, but different species. Here you get more gases than with the Clostridium perfringens, but absence of pain, no pain, swelling and toxicity, and is much less serious than gas gangrene. So you have to be able to ask the patient whether he has got pain or not, and you can see whether there is swelling, toxicity. What's the meaning of toxicity? Hypotension, tachycardia, etc. Right? So this condition, anaerobic cellulitis, is much mild than the gas gangrene of Clostridium perfringens. Clear the difference? Diagnosis, of course, clinical isolation of the microorganism is an adjunct. Adjunct يعني إضافة. You can do gram stain, you can do culture, and you find the microorganism similar to what they have done in the case scenario that I have just discussed to you. What to do? Excision is very important. It's called para-amman. Para-amman معناتها very important. Okay? It's para-amman to do excision. Excision, يعني removal of the tissue. Penicillin in mass doses. You can give also within cephalosporin, which is give a broad spectrum cephalosporin. Sometimes we use hyperbaric oxygen. هذه الميكروأورجانيزم شو هي؟ anaerobic. فلو وضعنا أكسجين على مكان الانفكشن, the microorganism will die. It is called hyperbaric oxygen, and there is a special chamber called hyperbaric oxygen chamber. Now we come to the second microbe, which is Bacteroid fragilis. Bacteroides fragilis. This is opportunistic, as we said. Gram negative, remember. Gram negative. Clostridium perfringens is gram positive. This microorganism is capsulated. Has capsule. Anaerobic, of course. Produce superoxide dismutase, an enzyme which can destroy tissues. It is an endogenous bacteria. It's present with the intestinal flora. So it is opportunistic. Usually it doesn't cause harm. in the intestine. But if there is injury to the bowel, bullet injury, stab injury, طعن, these microorganisms can cause diseases and infections. These are the microorganisms we said gram-negative, and we said they are capsulated. You can see they are gram-negative, pink in color. The clinical capsule, they can cause, when they cause infection in the abdomen, deep pain, tenderness, below the diaphragm, present in the intestine. And depending on the extent and spread of the microorganism, they can cause intra-abdominal abscesses. Intra-abdominal abscesses. Once you get abscesses, you get fever and other clinical manifestations of infection. Pathogenesis, they are relatively tolerant to oxygen. This helps also in their survival. يعني مو absolutely anaerobic. They can tolerate a little bit of oxygen. واضح? The capsule of the microorganism, you know, the capsule has antiphagocytic activity. تمنع الفاغوسيتوسيس. And these microorganisms can cause abscess formation. They are beta-lactamase producer. So the beta-lactam ring can be destroyed. Antibiotics like penicillin, cephalosporins can be destroyed by this microorganism due to beta-lactamase producer. So they are gram-negative, capsulated, beta-lactamase producer, okay? Now the immunity against this microorganism, of course, this microorganism has got capsule, so the body will form anti-capsular antibody. And once you get the microorganism with antibody and complement, C here is the complement, ثالثه antigen, antibody, complement. And the protection is also cell-mediated, that is, depends on the T cells. Manifestation, the microorganism is not invasive. It can stay in the intestine. But once you get a trauma or injury, you may get peritonitis. شو معنى peritonitis? Inflammation of the peritoneum, which surround the intestine. تمام? After trauma or rupture of the intestine for any cause, stab injury, for example. And as I said, there will be abscess formation. And once you get abscess formation, the patient will have fever and tenderness. May be associated with other anaerobic organism infection or enterobacteriaceae microorganism. That is to say, the organism that live in the intestine. Entero يعني intestine, like E. coli. A treatment, clindamycin, metronidazole, because these are effective against anaerobic organisms. Clindamycin and metronidazole. If you are going to use beta-lactam drug, you have to use beta-lactam drugs which are resistant to beta-lactamases. Not sensitive, otherwise will be destroyed by the beta-lactamases of the organism. If you have abscess, قاعدة الأبسس الذهبية بالجراحة وإن شاء الله تأخذوها السنة القادمة to drain the abscess. واحد ينظفها للأبسس. The last organism is Trichinella spiralis. It is intestinal parasite of flesh-eating animals. Flesh-eating animal يعني الانيمالز آكلة اللحوم، مثل من؟ الخنازير، pigs. Flesh-eating animals. The life cycle, we will see it in a moment. The infection that is usually caused by these organisms is usually subclinical. Larvae can be seen in the striated muscle, in the heart, in the CNS, and also you get inflammation of the tissue, and you get infiltrated by N. What is N? N is a neutrophil, L lymphocyte, E eosinophils. This is worm infection of tissues. And you get antibodies produced against these organisms like IgG and IgM. You know, these parasitic infections usually raise the eosinophils. So there will be eosinophil mediated destruction. The destruction of these larvae is mediated by the eosinophils. Also, you may get immune complexes between the antibodies and the antigen of these parasites, and this can result in vasculitis. Okay? التهاب الأوعية الدموية, vasculitis. You can see here the life cycle. It is very simple life cycle. This is the pig, which is carnivore, ingest scraps, أكلة اللحوم, flesh. البيج يأكل لحوم وcarcasses. And now the larvae from the cyst in the skeletal muscle swallow the larvae and can form cyst in the skeletal muscle. A patient come and eat pork meat containing these cysts, okay? Ingest them, they go to the intestine and form adult worm. And the adult worm will produce a new larvae that penetrate the intestine, and mucosa, and go to the circulation. The larvae invade the skeletal muscles of a human being, you can see, and also invade the heart. So quite simple. Now, if I want to know whether the muscle contains these larvae, we say the Trichinella spiralis. So they are spiral, حلزونية. تمام؟ فإذا you can see the coiled larvae. You can see the coiled larvae. So if I take a muscle biopsy and put copper slip over the biopsy and the slide and press them, squash them, okay? You will get these coiled larvae in the muscles. This is very characteristic. So it is called squash prep. شو معناته prep? Preparation. squash يعني الدعس، تدعسها. Okay? Clinical manifestation of Trichinella spiralis. The larvae penetrate from the intestine and can cause abdominal pain and diarrhea, and then they go to muscles. The symptoms depend on the number of larvae in the muscles. If you get less than 10 larvae per gram of muscles, it will be symptomless. If it is 100 per gram of muscle, 100 larvae per gram of muscle, it will be symptomatic. If the number is between 1,000 and 5,000 in a gram of muscle, it will be very stormy, عاصفة, lethal, killer. Complications, they may invade many tissues. The patient may get eye swelling, conjunctival hemorrhage if they are present in the eye, hemoptysis, and they may get heart failure if they infect the heart. We said it can infect the heart. Diagnosis, we said eosinophils are increased in any parasitic infection. So this is parasite. So you get eosinophilia 15 to 50%. Of course, IgE will be increased, again, parasite, and we mentioned this point previously. We said that during parasitic infection, eosinophils are increased and IgE also increased. Muscle enzymes increase. You know, there are muscle enzymes like CPK, okay? Due to destruction of the muscles, these enzymes will be high. Immunofluorescent and ELISA, you can detect the antibodies against these organisms. From where we take the biopsy? We take the biopsy from the deltoid muscle, وشفنا بالصورة الdeltoid muscle مصابة, and gastrocnemius. This is the gastrocnemius of ظهر الساق, and it's called gastrocnemius muscle, and you can see the encysted larvae from the 3rd week on. يعني مو أول يوم يبلعها المريض أنت تدور على encysted larvae. Of course, it will take about 3 weeks to reach to the muscles. The treatment, you know, there is an inflammation. You have to decrease the inflammation. So corticosteroids in severe cases with edema, pulmonary heart CNS involved. So corticosteroid to suppress the inflammation. Mebendazole, albendazole, we said these are anaerobic. Okay? So antihelminthic use with caution due to hypersensitivity and due to destruction. These larvae could be killed very rapidly, and their antigen will be released, which can cause hypersensitivity. So one has to be careful about this point. The prevention, follow feed regulation of pigs, follow منطقة الشرق الأوسط قليل, and limit the contact between domestic pigs and wild animals, wild pigs, because it can be transmitted, and thorough cooking of the meat. Any questions?